This is One-on-One. We are pleased to be joined by our good friend Keri Logosso-Misurell, Director of the Greater Newark Healthcare Coalition. Keri, I want to thank you. You've joined us many, many times here on public television, but this particular time deals with this initiative called Right from the Start NJ. First of all, before we talk a little bit about the coalition, talk about the importance of this campaign, this public awareness campaign, right from the start.
So Greater Newark Healthcare Coalition is a nonprofit whose mission is to achieve health equality for the residents of Newark. And Right from the Start campaign is about getting rid of inequalities and setting the stage for the best possible chance for equitable lives for children and families.
So let's break this down a little bit. The Right from the Start, excuse me, Right from the Start NJ is all about, I keep saying birth to 3, but it's really prenatal to 3.
Yep.
And giving those infants and toddlers every opportunity, right, to become what they can become. What inequities are we talking about?
So in the prenatal period in particular and birth through 3, there's a lot of brain development that's happening. The most in your life is happening in that critical period. And so you want to maximize the opportunity to create healthy brain development and brain functioning. But there's also another layer. Especially in the prenatal period, there's an opportunity to help the mom understand her health better and her stress level and her life and how she can be better supported to be the best parent that she can be. And that also has a positive impact on the development of her child.
What would it take? It's interesting. Some of this is about public policy. Some of it is about societal attitudes, but some of it is about parents themselves. Can you talk about the societal responsibility to help?
So I think the societal responsibility is tremendous. It's probably the most important responsibility we have because we want to unlock people's potential, right? So we want people to be, people want to be the best parents they can be. People want to be the best people they can be. So to me, the Right from the Start campaign is about giving people the knowledge and the tools to help them get there.
What happens if a 2-year-old, he or she does not get quality, consistent, impactful childcare? What could happen for that child? Because of economics, because of access, because of a whole range of reasons. What happens?
So when we say, you know, he or she is not getting the right or best child care, what comes up in my mind is things like healthy attachments, cognitive, education and learning things like vocabulary.
Social skills?
Social skills tremendously. And also related to social skills, there's a lot to be learned and modeled about self-regulation.
What does that mean?
So understanding emotions and what you're feeling inside and how that translates into behavior. So one example that's a free tool that we can teach children and adults alike that we'd all benefit from is breathing and mindfulness, things that, you know, maybe we shy away from. So
you feel stress coming on. You're starting to get upset about a situation. Not that that's ever happened for me here in public broadcasting.
Me either, right?
So what would one do? And by the way, what does that have to do with birth to 3? Go ahead.
So recognizing, giving children and adults the tools to know what that feels like. Is your chest tightening? Do you feel your blood pressure going up? Are you feeling frustrated?
Children?
Absolutely.
But what about for the parents?
Both. It's both. They're in
so
an
parents
ecosystem.
Are watching right now, or would-be parents, right? Our executive producer here of this series, Jen, is about to have a wonderful baby, right?
Yes.
I'm stressing her out all the time with, you know, the things that I'm asking for and demanding and asking. It's stressful. She should be doing what? Learning to breathe?
That is a core strategy. It sounds simple, but undoubtedly.
What's the impact?
So it brings down your blood pressure, it calms you down, and now what we understand is it allows the parts of the brain to receive information instead of being in a hyper state where they can't learn, they can't think rationally, and can't make decisions well.
And for a 3-year-old,
absolutely,
he or she can, model, learn, and
both.
Where would this happen? At home and in the child care center?
Everywhere. So that's part of what this campaign, what excites me about this campaign is it's...
Right from the start.
Right from the start is showing us that this is a multi-sector opportunity, and we all have a part to play, so there should be consistency from home to childcare setting in how children and adults are behaving and learning and growing together.
You know what's so interesting is, as part of the forum, we had 8 professionals, Keri being one of them, in our Right from the Start NJ forum. There's a 3-part series. Check it out on public broadcasting, on FiOS, other platforms, but also go on our website to see some excerpts. One of the issues that came up that you talked about, I want to talk about now, is screen time. Screen time, handheld devices, you know, the iPad. For us as parents and for 2, 3-year-olds, which sounds crazy, right? What's the issue?
So there's no replacing human interaction. We know that now. There's scientific studies in interpersonal relating. That's different than screen time. And so we'd be better off learning strategies that are fun and engaging that don't involve screen time. So there's simple things, and music together is a great example, incorporating song into the learning environment, the home. It is. And it's being incorporated more now into childcare settings and should be expanded. Music, the element of music is a great way to both learn, experience new things, and be together.
Final question.
Yeah.
You deal in the city of Newark, my hometown, brick city, if you will. It's a tough place, and there are an awful lot of folks who are living below the poverty level there now. What is their biggest concern, the greatest concern for their babies and toddlers?
I think this is a unifying issue. Everyone wants the best for their children. So things like access and quality and opportunity to childcare, to healthcare, to education and opportunity.
Are they, how fearful are that they that they're not going to get it?
Very.
What does it do to people?
So there's a level of stress, unfortunately, burdening many people in Newark and elsewhere, but I'll focus because our work is in Newark, and people are disproportionately burdened.
Areas where people are struggling financially big time.
Right, and I would challenge us, that's not by coincidence. So there are systemic reasons and inequalities, as you know, I mentioned, that create those burdens of stress on people. So that toxic stress has a cumulative impact on people. Toxic stress, we now know, is something real on the body, on the brain, on behaviors. It creates lifelong health consequences, premature mortality, and diminishes the quality of life for people unnecessarily.
You know, the term toxic stress, Dr. Arturo Brito from the Nicholson Foundation, one of our partners in this initiative, wrote an op-ed piece with Kirtland Fields from Terrell Fund. And he talked about this as a clinician as well. He used the term toxic stress. That's not healthy stress.
It is not.
It's bad.
There's things we can do about it, though.
Well, you're doing something every day, and I want to thank you for being part of this initiative right from the start. Thank you, Keri.
Thank you, Steve.
We'll be right back right after this.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. This special edition of One-on-One with Steve Adubato is brought to you from the Tisch WNET studios at Lincoln Center. Funding has been provided by Investors Bank, Holy Name Medical Center in Teaneck, New Jersey, Guarini Institute for Government and Leadership at St. Peter's University, the Turrell Fund, supporting Right from the Start NJ, United Airlines, the Northward Center, and by New Jersey Sharing Network. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.